Did you know that trauma isn't necessarily what happens to us, but rather how our brains and our bodies respond to these events? Hi, my name is Micheline Maloof. I'm a licensed therapist, and I'm going to be talking all about trauma in this video. I'm going to talk to you about what trauma is, what can offset trauma, how it shows up in your body and emotionally, and finally, I'm going to give you 3 tips to help you start healing. So if you have not subscribed to my channel yet, please hit the subscribe button and follow along as I have some amazing content coming for you guys. Trauma is not necessarily what happens to us, but trauma is how our nervous system perceives what happened to us. We are all wired for connection, and if we're not receiving the type or the amount of attention that we need, even if we have food on the table and a roof over our heads, our nervous system will perceive that as deprivation and danger. The traditional definition of trauma is anything that causes us intense fear and leaves us with a sense of helplessness. And I would like to add that it can also be the things that don't happen to us, the connections that we don't have, the experiences that we miss out on, or anything that causes us to have a significant loss and that feeling of not being enough. 80% of adults in the US will experience what we consider a traditional type of trauma, but only about 11% of those will have a PTSD diagnosis. That's because when we experience a traumatic event, if we have certain resilience factors and can reach emotional and physical safety, then we can offset the impact of trauma. What are resilience factors? If you think of trauma as little fires everywhere, you can think of resilience factors as the water or the rain that helps minimize and sometimes even turn off the fire. The things that help us come back to safety and feel less alone are called resilience factors. So resilience factors are the factors that contribute to how well we can adapt or change in times of challenges and adversities. Some of the resilience factors that can offset the impact of trauma include: Number 1, having a loving family or a parent that's open and empathetic. Number 2, having availability to quality resources such as medical care, supportive teachers, safety resources, mental health resources, self-coping strategies, and your socioeconomic status. Number 3, social connections and good friendships. Number 4, extracurricular activities. Number 5, feeling like you belong. And number 6, having hope for the future. We're going to talk a little bit about how trauma shows up in our bodies and our minds through symptoms and what you can do about it. But first, let's talk about some of the things that you may not have known could cause trauma. Number 1, emotional neglect from parents, whether it's intentional or unintentional. Maybe your parents had to work a lot to put food on the table and couldn't be there for you consistently, but your nervous system does not know the difference and it doesn't really care why. Number 2, your parents were constantly arguing or fighting. This creates a lack of safety in your home. Number 3, living with someone who has a chronic illness or having a chronic illness yourself. Of course, watching someone struggle with their health is really challenging. It causes fear, and there's a lot of time taken away from healthy, meaningful, quality time with that loved one. And having a chronic illness yourself is, of course, extremely traumatic, and it can change your quality of life and make you feel isolated. Number 4, being emotionally manipulated, gaslit, or having your feelings dismissed or ridiculed with sarcasm. Many people use sarcasm not understanding its true impact. When sarcasm is used inappropriately, it can be extremely harmful and cause feelings of inadequacy and shame. Number 5, constantly moving. When we're moving constantly, we never get the opportunity to feel safe and secure in our relationships. Our life is filled with losses and a lack of stability, which can be extremely stressful. Number 6, living with a caregiver that is addicted or abuses substances. This may cause them to be emotionally unavailable or even emotionally or physically abusive at times. Number 7, religious shame. Some religions instill shame for basic human feelings and thoughts. There are right thoughts and wrong thoughts. They say that these are right and these are wrong, and you may also have been taught to fear a God. You will be punished if you do something wrong or think something wrong, which keeps your nervous system on high alert. And of course, not all religions cause this religious shame, but some extreme forms of religions can be extremely damaging. Number 8, being bullied. Being bullied is a form of emotional and sometimes physical abuse. Abuse does not only come from family or someone older than us. It can happen at school, from our peers, from our teachers, coaches, and many other areas. These are just a few of the things that are often overlooked that can lead to trauma. So take a look at these and see if any of these resonate with you. And then let's talk about how trauma shows up in our bodies and emotionally. So how does trauma show up physically? Here are some common ways that trauma can show up in your body. Number one, hypervigilance. This can look like being easily startled or having a heightened fight, flight, or freeze response. Number two, you might feel exhausted all the time, even when you're getting enough sleep. You never truly feel rested. Number three, you have unexplained chronic pain, specifically in your jaw, in your shoulders, in your back, in your neck. Number four, you experience gastrointestinal issues, most likely IBS or acid reflux. Number five, you have chronic headaches, like migraines and tension headaches, and they seem to kind of be resistant to medication. Besides showing up physically, trauma can also show up in your everyday life, in your relationships. Here are some of the ways that it can show up on a day-to-day basis. Number one, you might constantly be feeling down and sad and overwhelmed, and you're not really sure why. Number two, you might dissociate and have a really hard time staying present and focused. Number three, you might experience a lot of anxiety and panic attacks, and oftentimes you can't even pinpoint where those are coming from. Number four, you have a hard time trusting people and forming meaningful, deep relationships. Number five, you experience low self-esteem. And number six, and this is an extremely common one, you're a people pleaser and have a very difficult time setting boundaries. Okay, so what can we do about it? How can we begin to feel better physically and emotionally? I have 3 tips for you that I want you to start with, and I need you to do these things every single day because it's consistency that will help us reach the goals that we want. The first step is always regulating our nervous system and our body. So of course, my first tip is I want you to set up a daily practice of body scans. This is so important because you really need to know where the trauma is manifesting in your own body. Where are you holding the tension? So what you can do is start at your head. Practice noticing and releasing tension from the top of your body all the way down to your toes. You can do something called progressive muscle relaxation. There's tons of audios on YouTube, and I actually just recorded one, and I'm going to link it here so that you can come back to it and use it daily. You don't even need to watch the videos of the progressive muscle relaxation. Just put on the audio and let it play and follow the guidance. Number 2, the second tip, practice a daily mindful movement activity. This could be walking or yoga or just disconnecting and eating mindfully. This is so important because people that live in traumatized bodies are constantly in the fight, flight, or freeze modes, and they have trouble being in the present moment. And one important thing to remember is that trauma cannot live in a relaxed body. Think about it. When you have a relaxed physical body, no tension, you're not in fight or flight. It's the opposite. So a daily practice of mindful movement and body relaxation techniques will help you release trauma in the long term. And finally, and this is an extremely important step, grieve. Grieve what you have lost. Grieve the childhood you did not have. Grieve the broken heart. Cry, let it out. Grief is experienced across many different categories, not just death. You can grieve the child within you that never got the comforting and empathetic parents. You can grieve the experiences you missed out on because you were too busy taking care of the people that were supposed to be taking care of you. You can grieve the loss of a pet or a friendship. Let it out. Cry, journal, grieve. Grief has no timeline, and it's never too late to begin this process. I really hope you found this video helpful. I hope that you learned about how trauma is manifesting for you or really got some insight into what it could be doing to your physical body. And I hope that these tips help you. These sound like very basic tips, but it can be challenging to incorporate them daily. So please Try to set aside some time for yourself, incorporate these daily, and check back in a month, in 2 months, in 3 months, and see how your body and your mental health will improve. Of course, if your trauma is severe and it's just too overwhelming to even begin these steps, if you have access to professional resources, I would highly recommend getting professional help. It's always a good idea. Thank you for watching this video. I hope you enjoyed it. Please give me a thumbs up if it was helpful. Drop a comment below, ask me a question if there's anything I didn't cover or you have more questions so that I can make more videos to help you out. And make sure you're following me on Instagram and TikTok as I post so many tips about trauma, anxiety, depression, panic on a daily basis to help you. Thank you again for watching, and I'll see you next time.